Why have Victorian era diseases that killed millions returned to Britain? There's a paradox at the heart of the 21st century that's hard to ignore. We are on the cusp of revolutions across a wide range of fields as scientific and technological advances converge. We've got smartphones, electric cars, and even the possibility of space travel. And yet, Victorian diseases like scabies, syphilis, tuberculosis, and even scurvy, diseases we thought were relics of the 19th century, are back here in Great Britain in 2024. So, what happened? Why are these conditions reappearing? And what does it say about modern Britain? Let's dive in. In the Victorian era, cities like London were notorious for their overcrowded slums, poor sanitation, and a stark divide between the rich and the poor. These were the breeding grounds for infectious diseases. But thanks to modern medicine, vaccines, and improved hygiene, most of these diseases were all but wiped out in Britain. So, why are they making a comeback now? Firstly, let's look at scabies. Scabies is caused by tiny mites that burrow into your skin, creating itchy red patches. It spreads quickly in crowded situations and close contact, exactly the kind of environment found in large cities and even care homes. In 2024, scabies is seeing a resurgence. NHS figures reveal a staggering increase, with 3,689 cases diagnosed in hospitals in England in the year to April. That's up 2,128 on the previous year. Scurvy, a nutritional deficiency disease caused by a severe lack of vitamin C in the diet, has also made a comeback. Doctors in the journal BMJ Case Report warns scurvy may be re-emerging after treating a middle-aged man with the condition. This disease of the past causes a slew of disturbing symptoms, such as bleeding gums and skin discoloration. It must be noted, scurvy is still relatively rare in the UK. Just 171 cases were reported last year. But this is a significant jump on 2007 to 2008, when only 63 cases were reported. The list goes on. Syphilis, sexually transmitted infection, was rampant during the Victorian era. For a while, it seemed like we had it under control. But this year, syphilis is back with a vengeance. Data from the UK Health Security Agency in 2023 shows diagnosis of infectious syphilis increased to 9,513, up 9.4% compared to 2022. Childhood diseases, infectious diseases, including measles and whooping cough, are also on the rise. There have been 9 reported deaths of infants from whooping cough in England since November last year, while the latest figures from the UK Health Security Agency show 12,200 confirmed cases between January and July 2024. Since January, there have been 2,465 confirmed measles cases reported in England. Measles is very contagious and can cause serious complications, such as swelling in the brain. Meanwhile, rates of tuberculosis, which killed 1 in 7 people in England at the dawn of the 19th century, are creeping up. Let's take a closer look at the figures. Provisional data from UK HSA shows TB notifications increased by 7.5% in the first quarter of 2024, compared with the same quarter in 2023. There was an 11.2% rise in TB notifications in the first updated 2023 figures, compared with 2022, rebounding above the pre-COVID-19 pandemic numbers in 2019. Increases in TB notifications in quarter 1, 2024, compared with quarter 1 last year, were unevenly distributed across regions in England. So, why are we seeing a comeback of these Victorian diseases in 2024? Well, it's complicated. Diseases of the past are roaring back to life, thanks to declining vaccination rates, poor diets, and cuts to public health budgets. Take the decline in vaccination rates first. The whooping cough vaccine is offered to all pregnant women between 16 and 32 weeks of pregnancy to protect their babies. but most recent figures suggest uptake is just 60%. Meanwhile, data also shows World Health Organization targets of 95% vaccination for under 5s are being missed in England, which includes the 6-in-1 jab, which protects against whooping cough, polio and tetanus, as well as the measles, mumps and rubella vaccine. Backlogs caused by the pandemic are also driving up the rates. The jump in figures in tuberculosis, for example, partly reflects a rebound in access to the diagnosis and treatment of TB following serious setbacks during the pandemic. Then there's the cost of living crisis, which is also making it harder for families to afford good quality nutritious food, which in turn leaves people vulnerable to the disease. The middle-aged man treated for scurvy, for example, stopped taking nutritional supplements prescribed for him after previous weight loss surgery because he said he couldn't afford them. Blood tests to assess his general nutritional status indicated no detectable levels of vitamin C, and he was also deficient in other key nutrients. Public health services in the UK are also facing significant challenges due to funding cuts over the past decade. The public health grant, allocated by the Department of Health to local authorities for preventative health services, has seen a substantial decrease of 28% in real terms since 2015. This reduction in resources has left many essential services, such as sexual health clinics, struggling to provide adequate testing and treatment. Professor Sir Chris Whitty, the Chief Medical Officer, has highlighted the link between the surge in sexually transmitted infections and the decline in public health funding. He warned MPs about the dangers of syphilis, emphasising its potential for multiple complications. The impact of these budget constraints extends beyond sexual health services. NHS services and GP surgeries are also feeling the strain, contributing to falling vaccination rates for infectious childhood diseases. Councils have raised the alarm about the dire state of public health services, describing them as being at breaking point due to the lack of funds for crucial testing and treatment programmes. So, what can be done about all this? Clearly, there is a battle that must be fought on multiple fronts. Firstly, we can push for better access to healthcare. Health screenings and early interventions are essential here. The public healthcare budget also needs to be expanded. Secondly, addressing food poverty through better social support and food programmes can tackle issues like scurvy. And finally, we must break down stigma around conditions like syphilis and TB. That will encourage people to seek help sooner. Improving vaccine coverage is also a must. This will involve educating the public of the importance of vaccination and the dangers of these diseases that have come out of the woodwork. Many of the diseases we are trying to protect against have not been seen in a long time, and so the perception within the general public of the importance of vaccination seems to have dropped. Then there's the elephant in the room that must be addressed: busting harmful myths around vaccination. By getting vaccinated, you are protecting yourself, but you're also protecting your friends, your family, and you're protecting the most vulnerable in our community who cannot get vaccinated themselves. The NHS offers this service, so you can get vaccinated easily and conveniently. It must just remember, Victorian diseases have made a comeback, but with the right healthcare interventions, we can banish them back to the past.